My name is Kelly, and I work as a credentialed veterinary technician in an emergency and critical care setting. A typical day for me involves a 12-hour shift. I work from 8 a.m. to 8 p.m., and I work pretty much any time during the week. So I might work on a Saturday or a Sunday, or I might work on a weekday. My duties are pretty much related directly to patient care. I function also as a diagnostic technician, doing blood work, taking radiographs, and participating in things like ultrasounds and endoscopies as needed. I also work as an anesthesia technician, working with a boarded surgeon. But the vast majority of what I do involves making sure that patients are clean, that they're comfortable, that they receive the appropriate medications in a timely manner. I also do things like bandage changes. I do things involving phlebotomy, involving prepping them for surgery. I also do a lot of interacting with clients, the people that own the animals, so I might give them telephone updates about their pet's condition or changes in their status. I also am involved when clients come to visit their pet, and I also act as a go-between between the doctor and the client as needed. I also work with assistants and guiding them in their tasks and letting them know how they can best help me and the pet. I do a lot of restraint, and I also do a lot of hospital maintenance. In terms of the level of stress involved with my work, I would say that it's certainly more stressful than it would be to function as a nurse in a general practice setting doing preventative health care. Emergency and critical care medicine is probably one of the most stressful branches of veterinary medicine to be involved in, and it can be very draining emotionally when patients do not survive or when clients don't have the necessary funds to pursue recommended treatment. It's something that you do have to adjust to as a technician working in this environment, but most practices provide resources for you, not necessarily counseling, but they make you aware of the effects of compassion fatigue, and you are certainly able to find kind of a safety net with your coworkers and your employer. And it's important to maintain a healthy balance in your personal life as well, to have a hobby, to have a family life, to get exercise, and to take good care of yourself. And I find that it's fairly easy, if you invest in yourself in that way, to survive the stresses of the job. In terms of pursuing a career in veterinary technology, most states require that you obtain a 2-year technical college degree. And that can either be an Associate of Applied Science or an Associate of Applied Technology. Various colleges offer various degrees. So you might get the AAT at one college versus the AAS at a different college. It's a 2-year degree, and it is awarded in veterinary technology. You can pursue additional training. There is a 4-year degree that is available in veterinary technology. It's not available at every school that offers a veterinary technology degree. If you earn the 4-year degree, you can be considered a veterinary technologist versus a veterinary technician. You can also, after you've obtained your 2-year degree, pursue additional education in the areas of either veterinary nursing or practice management, so there are additional certifications available. Most places don't offer internships per se. You may do internship work as part of your 2-year degree, for example, at a university teaching hospital or at a private clinic. But the best way to kind of get into this field is to either start by volunteering at, for example, a humane society or the vet clinic of your choice if they permit interns, or to take a job as a kennel assistant, a veterinary assistant, or a groomer's assistant, just so you can start working with animals and see the work in action and potentially be around credentialed technicians and veterinarians, so you can get a feel of what really happens in a clinic on a day-to-day basis. In terms of skills needed, I would say that you definitely need to be able to interact with people and with animals. You need to be able to be well-spoken and coherent in both your written and verbal communication, and you definitely need to have strong skills in math. Being fascinated by animals and sort of being obsessed with them and really enjoying spending time with them and being curious about the way that they work and the way they perceive the world is also very helpful. So now it's time to talk about the best parts of this job and the worst parts of this job. I would say far and away the best part of this job is being able to make a difference in the lives of our companion animals and also in the lives of their people. For someone who is interested in potentially a nursing career but is not very interested in working with people for whatever reason, veterinary medicine is awesome, because pretty much anything you can do with a person in terms of medicine, blood transfusions, surgery, transfusions of other sorts like albumin, things like organ transplantation, CT, MRI, you can do on animal patients. So you get all the pluses of making a difference, providing comfort to patients that might be distressed or in pain, providing comfort to people who are just incredibly distressed because this family member is not doing well. It is absolutely worth it every day. There's never been a day of my career that I've thought, I really need to get out of this. Today was not worth getting out of bed. That having been said, the worst part of my job in emergency and critical care is kind of twofold. One, there are syndromes and diseases and conditions in veterinary medicine that we just can't fix. You're going to lose patients, and you are going to, sometimes make people cry because you're not going to be able to fix it. And that's very, very difficult when you are attached to a patient and their family, when you care about them, when you want a happy ending and a positive outcome, and for whatever reason that doesn't come about, it can be crushing. The other part of this job that's very difficult is in emergency and critical care medicine, we're kind of available 24/7. There's not so much things like holidays and weekends. Now, certainly, depending on where you work, you have the possibility of getting a schedule that really works for you, but someone has to work the night shift. And in the course of my career, I've worked 6 p.m. to 4 a.m. I've worked 10 p.m. to 8 a.m. I have worked, 8 to 8. I've worked 12 to 12, 11 to 11. So it can be very difficult to have, quote unquote, a normal family life when you are working shifts like that. So I would say to anyone who is thinking about this that you need to be aware that there are going to be times when you might miss things that you don't necessarily want to miss because of your schedule. I have a lot of advice for you if you're interested in pursuing a career in veterinary technology. One, I want you to know that there are more things open to you in veterinary medicine than just being a veterinarian. But at the same time, veterinary technology is not a refuge for people whose grades are too poor to pursue vet school. I would tell you, if you're interested in actually providing nursing care for animals of all types, be they zoo animals or farm animals or companion animals, then veterinary nursing, veterinary technology is definitely for you. But you need to be aware that this is a medical career. This is science. There's going to be math, and there's going to be chemistry, and there's going to be pharmacology and biology that you're going to need to get through. This is not just playing with puppies and kittens. There are times when you are going to have to make patients uncomfortable in order to make them well. And if you find that you are not comfortable with that, then this may not be the career for you, and there are certainly other animal handling careers that would be great for you. But if you want to provide high quality care to patients of all sorts, I think it would be wonderful if you joined us. Keep in mind that just because you're working with animals, it does not mean that there are no people. I think a big mistake that people make when they approach veterinary technology and veterinary medicine in general is they assume that because I'll be working with animals, I won't have to deal with people. They might say, I don't like people, people are annoying, I don't want to have to deal with them at all. But the fact is that behind every patient, be they small animal, large animal, zoo animal, aquatic animal, production animal, there is a human element. Even if you're in laboratory animal research, there are still human committees driving what you're able to do with the animals. So I would tell you, if you are feeling a little misanthropic and you want to avoid human interaction, veterinary medicine and veterinary technology are not for you. Now, if you would like to bridge that gap between the medicine and the people behind these animals, then veterinary technology is perhaps a perfect career for you.